Hello, my name is Janine Jones, and I'm coming to you from the Heart's Way for Creative Clinicians. Today's topic on our video is about revolving door clients, and it's titled, Don't Give Up on Your Clients, Lessons Learned from Revolving Door Clients. So what are revolving door clients? Well, if you've been a clinician for any length of time, you may know that sometimes we will have situations where clients come back again and again and again for repeated admissions. In fact, when I was a clinician and working in a community mental health setting many years ago, we used actual paper records. I don't know if any of you will remember those, but I certainly do, back before the days of electronic medical records. And in order to kind of illustrate what a revolving door client's chart would look like, I want to show you a little something that I put together. This is an example of what you would see with a revolving door client. On this side of the chart, this is where we place all of our demographics, our intake assessments, our treatment plans, and our discharge summaries. Sorry if you can't see me. On this side are all of the progress notes. But what's more important for you to see other than these things is to look at this. Now, lots of records were much, much bigger over here than over here. And when you see a record, or when you would see a record that had multiple pages on this side and very few on this side, you knew that this was a client that came back in for multiple admissions and then discharged multiple times. But when they were in for treatment, they did very little in terms of being involved in treatment or making progress. So I just wanted to give this to you as an example. Basically, I know that when working with our revolving door clients, it can bring about a lot of challenges and frustrations when we're seeing the client for multiple admissions. I want to tell you a little bit of a story. When I lived and worked in North Carolina many years ago, I was a supervisor for a fairly large department. And at one point in time, the people that I supervised, we saw a total of approximately 1,600 clients on average, divided amongst all of the different clinicians. And that was pretty difficult in and of itself. It was a challenge to try to help all of these people. And these people were in what they called then the severely and persistently mentally ill kind of category of people that needed help. We had many clients that were revolving door clients. When clients came in for admission, a lot of times what would happen is that they would come back to the same clinician that they saw before. And as a supervisor, I would start to hear many complaints and frustrations about having these clients come back over and over again into this particular clinician's caseload, whoever that clinician was. And that became very difficult because with it came a lot of challenges and the mindset that nothing will happen with this particular admission, with this particular client, because all they're going to do is to drop out of treatment and nothing will happen, nothing will change, it's a waste of my time, etc., etc. And so basically, my goal as a supervisor was to try to remind them that you never know that perhaps this time, this admission will be the one time, the one admission that this client needs and that they will make progress. And it's the time that they most need you. So I would always try to encourage my clinicians to see these clients with an open mind and to remember to don't sell these revolving door clients short. So how do we tell where a person is when they come in for treatment, especially if they're a revolving door client? Well, I think that it's really helpful if we can assess this client for their current level of motivation and readiness for treatment. It's helpful to compare what's going on now with the client as opposed to what was going on in past admissions. What's different this time? And what's happened in the interim? In terms of the technique called motivational interviewing, it's very helpful to look at the stages of change to assess where a client may be in terms of their readiness and motivation for treatment. So I've brought along a few illustrations for you to take a look at the different stages of change. The first stage of change is called pre-contemplation. And in this level of change, the client does not yet acknowledge that there's a problem. Oftentimes, we would see this with clients that came in that were court-ordered for treatment. They're not here because they want to be here. They're here for treatment because somebody has told them that they have to be. The next stage of change is called contemplation. And with contemplation, this is where a client knows that there's a problem, but is not ready yet to make a change. Now, a lot of times a person in this stage of change could be starting to contemplate that they want to make a change. An example of this would be somebody who has had multiple admissions for substance abuse treatment. The next level of change or stage of change is called preparation or determination. And this is where the client is getting ready to make the change. They've seen that there's a need for it. They've contemplated whether or not they should do it. And now they're thinking and trying to get ready to start making that change. And in this kind of setting, you might see your client, your revolving door client, returning and start talking about treatment options. The next stage of change is called action or willpower. And in this stage of change, the client is actually making a change. In this stage of change, you will see that your revolving door client is actually working on their goals, which is fantastic. The next stage of change is called maintenance. And this is where the client is maintaining their positive change. Again, this is a good place for people to be. And in treatment purposes, you may start seeing this client less frequently. You know, as you work on goals and the client is accomplishing goals, then our involvement, our connection with them does not need to be as frequent. So you might see this as a client that you might see on a monthly basis. And then the last stage of change is called relapse. And unfortunately, this is where the client has abandoned their new changes and has returned to their old behaviors. This is where we see the revolving door client, unfortunately, dropping out of treatment, perhaps again and again and again. So I think it's helpful if you can determine what stage of change your revolving door client is in when they return to you for treatment. And once you have determined that, you may be able, if they are in, for example, the pre-contemplative or the contemplative state of change, to be able to help them using a motivational interviewing technique called decisional balance. And the decisional balance is a matrix that is used to help us work side by side with the client, not telling them what kinds of changes they should make, but helping them to determine what different changes would be possible. And so I brought along an illustration for you to see. This is called it's a decisional balance matrix. And in this, what we do is we look at questions in regards to the problem that they're having, the issue that they're having, or the things that they are considering to make a change. In this first quadrant here, this is where we look at, if we make no change, what will be the advantages or the good part of that? The second quadrant is over here, and this would be, if no change is made, what would be the bad things that could happen, the disadvantages for that? The third quadrant has to do with making a change, and what would be the not so good decisions or good consequences if we did make the change. And lastly, quadrant 4, which is where we will make the change and to see what could come of it that would be good. Okay, I'm going to link access to this resource so that you can use it in your clinical setting in the description box below. But let's talk a little bit more about this decisional balance worksheet. For number 1, that quadrant number 1, the question is, what are the advantages of the status quo? So what are the advantages of continuing with the same behavior, such as drug use, non-compliance with diabetic medications, etc., etc.? Most professionals don't ask clients this question. Like, what are the advantages of continuing with this behavior? But when you do ask this question, it offers the opportunity for your client to talk about their problem in a non-defensive way. It short circuits resistance. The next quadrant, number 2, talks about what are the downsides of the status quo. For example, what are the downsides of not changing the behavior, like continuing to consume large amounts of caffeine when you're anxious? And this is where the phenomenon of change talk begins. Now, quadrant number 3, this is where you talk about the downsides of changing the behavior. For example, what are the downsides to exercising regularly for arthritis? Resistance continues to be short-circuited within this question. Clients in this question or this quadrant area may also begin to talk about their fears of change. And in quadrant number 4, the question is, what are the advantages of changing the behavior? What are the good things that would happen if I start a gratitude journal and voice affirmations for my depression? The majority of change talk is in this area. It's important to note that clients are now developing their own arguments for change in this quadrant. As a therapist, you could have advised your client to make these changes from the very beginning, but you may have met with resistance. There is no resistance, though, when change talk comes from the client. Now, another thing to remember with your revolving door clients, please remember that your consistency in how you treat this returning client is key. They need to see the same person every time that they come in. The same person meaning the same person who has the same types of attitude, the same amount of support and encouragement, the same amount of empathy, the same desire and willingness to work with that client to make positive changes. Many times with revolving door clients, there is nothing but inconsistency in their lives. A lot of times in their family and their friends, they've been abandoned, or they don't socialize with people anymore, or they never know when they can trust someone, or when someone is telling them the truth. And so a lot of times people will revert to negative thinking, negative attitudes, a lot of pessimism, and some suspiciousness, and just an unwillingness to make change if nothing around them is consistent. So it's very important that you, as their therapist, with each admission, remain consistent. I have a client that I wanted to talk to you about who actually was not a revolving door client, but I saw her for many years. She would continue to come in time after time after time, and she would continue to threaten to discontinue treatment. She would threaten to do many things, including kill herself. She had a diagnosis of borderline personality disorder, and the only thing that I really could offer her was consistency in treatment. I could tell her that I would be here to show up for her treatment, and whether or not she showed up on her end, that was her decision. I was consistent in terms of follow through with my responses to her potential dangerous behaviors. I was consistent in listening to her, consistent in basically just being there. And I don't know whether or not, I don't really think that she really liked coming in for counseling, but I think there was something in her that knew that she needed it, even though for many years she never made any progress. She was always resistant to any kind of suggestions that I had. But for some reason, she did continue to come in to see me. So although she didn't discontinue treatment, she was much like a revolving door client for me, because I would continue to see her time and time again with no progress being made, until something happened in her life. Her mother unexpectedly passed away, and something inside her changed. She, at that point in time, began to actively seek treatment. She began to engage in making positive very positive changes in her life. She had a lot of knowledge and information about how she had responded in the past, and she was able to use that information to make changes in the future. She developed her own behavioral contracts with me and with her primary care physician, and absolutely made wonderful progress in her treatment. So something did change for her. And I think the thing that helped her was knowing that I was still there for her as her therapist, and that I wasn't going to change. Because even as she started making these positive changes in her life, I did not change how I spoke with her, how I responded to her. I was always consistent before her big change and then afterwards. So, hope this has been helpful. I hope that this video has been helpful or will be helpful for you in your counseling practice. If you liked it, please give it a thumbs up, and please consider subscribing to the channel. Your support and your feedback is very, very much appreciated. So until the next time, I'll say goodbye, and I hope that you have a wonderful day.